I had sleep apnea, sleep study done in 1998. I even had surgery done, and it only partially corrected the problem. So I decided at that time, I made a conscious decision to just kind of live with what I had. And it was getting worse and worse. But what really firmed up my mind as to getting it dealt with was the court case in Kansas back in 2000, I think it was 7, where a commercial truck driver was convicted of vehicular homicide. And I have to say that I had 1 or 2 near misses over the course of the last 4 or 5 years driving. I have to say that. He had been tested and diagnosed with sleep apnea prior to the accident. That got my attention. I need to get this addressed. It was that important to me.
Well, as you would imagine, safety is it's our number one core value. One of the things that we have as part of our driver training curriculum, an awareness piece on sleep disorders. We also expand on that and have a section on driver wellness where we talk to them about the importance of a healthy lifestyle, diet, exercise, and those things.
The most common form of sleep apnea is called obstructive sleep apnea. Risk factors for obstructive sleep apnea include male gender, age, and increasing body weight. Associated conditions can include non-insulin dependent diabetes, high blood pressure, and a family history of sleep apnea. People with neck sizes greater than 17.5 inches are also at risk for this condition.
Some studies have shown that in untreated severe sleep apnea individuals, their driver reaction times are similar to someone who would be classified as legally drunk. In individuals with sleep apnea, they are literally stopping breathing or nearly stopping breathing many times per hour, every hour that they're asleep. The result of these pauses in breathing is that you don't get air into your lungs. And when you don't get air into your lungs, you don't get oxygen into the blood.
He would come home just exhausted, more so than what I thought was normal. Also, some definite red flags were when we were taking a road trip back in fall of 2006, and I noticed him dozing off at the wheel, which was a concern to me, and my children noticed it as well. I told him, I said, I won't take any more road trips with you until you get this problem addressed.
You're dealing with fatigue every waking moment that you're up. And I had to really consciously think about how I planned my day out, because everything was rationed because of the energy level. But I was always eating because I needed that infusion of energy, to keep going and whatnot, to force myself to keep going.
Clear-cut symptoms of sleep apnea include chronic fatigue, decreased alertness while driving, gasping breaths while asleep, and loud and chronic snoring.
One of the most important symptoms when it is offered is a bed partner who says, you quit breathing at night. That almost always is predictive of someone with sleep apnea.
Other clues to possible sleep apnea include frequent urination at nighttime, especially in a young man, depression, and irritability.
And like I said, none of this should hurt, so if I am hurting you at any point, just let me know, okay?
All right, very good. You show up, you talk with the technician explains what's going to take place over the next 8 or 10 hours. They do it in a comfortable bedroom environment. It's nothing clinical about it. So it takes about maybe 20 minutes to be all wired up. You have a wiring harness, and they just say, well, here, we're going to shut the lights off. You want to watch TV for a bit until you get tired, and then go to sleep. And so it's pretty straightforward. It's no big deal.
A complete diagnostic sleep study entails monitoring brainwave activity, which measures sleep, the quality of sleep, and the stage of sleep, measuring eye movement, measuring EKG, which is the electrocardiogram, chest and abdominal motion, blood oxygen level, airflow at the nose and at the mouth, muscle tone, and leg movement. These are all components of a complete sleep study. If you're diagnosed with sleep apnea, it's not something to be feared. It's actually something to be welcomed, like high blood pressure, diabetes, heart disease, high cholesterol. Sleep apnea is a condition that can be effectively treated if it's diagnosed.
All right, Ken. So what we're going to go ahead and do now is we're going to fit you for a mask.
All right.
Treatment for the greatest number of people is CPAP, which stands for Continuous Positive Airway Pressure. It's a small machine that blows air into a hose connected to a mask that fits over your nose or over your nose and mouth.
All right, Ken. So what I'm going to do is I'm going to go ahead and give you some pressure, okay? All right. Why don't you go ahead and lie down for me?
It's going to be a few hours, and I'm going to be driving tonight a little bit, so I think I'm going to have a nap. Take advantage of this time, this downtime. That breathing machine, you know, the mask, putting the mask on, that's no different than a pair of eyeglasses, orthopedic footwear, a knee brace. You know, these are all things that we use, people use in their day-to-day lives to make their lives easier and better. I mean, the breathing mask, for me to have it on at night is no different. I mean, it's that easy. I either accept that, because that's my ticket to a good night's sleep. So, you know, I'm not going to argue with that. You know, you just can't do this stuff overnight. I mean, there's no magic wand that you can wave. I mean, it's with anything in life. It takes commitment and time and just effort to want to improve yourself, to become better, to feel better, to be better.
If you have sleep apnea, you have it whether you're a commercial driver or not. And most commercial trucking companies now recognize this condition and understand that the Department of Transportation and the FMCSA do not consider it a exclusionary condition from commercial driving. If you have sleep apnea for personal reasons and for safety reasons, you ought to have it treated.
Waiting is not going to fix it. It's not this bad haircut approach that time is going to solve it. It will not solve itself unless you take the time to get it done.